And I would like to introduce you all to Sharon Burke of Life Energy Foundation. She is sponsoring all of our Wellness Wednesdays going forward. So thank you so much, Sharon.
Amy, thank you.
Yay!
And she will talk to us after Ashkan gives us his presentation. Okay, so today it's 8 o'clock, so we're going to get started. Thank you for joining us. And today we have a nice topic, and it's about whiplash injuries. What you don't know may hurt you. I think I can't wait to hear what you have to say. So I'll turn it right over to you, Ashkan.
Thank you very much. Good morning, everybody. I thank you very much for joining us this morning. And I wanted to actually thank Margie and Rockville Chamber of Commerce for setting up these talks. Thank you so much. My name is Dr. Ashkan Azami. I've been a practicing chiropractor since 1991. I started in Los Angeles and I have been opened up the Landover Hills location in 1995. And eventually the District Heights and Rockville locations on 121 Congressional Lane opened years later. Aside from managing everyday aches and pains, our main focus of care at Total Health Family Clinic is on evaluation and management of traumatic injuries. These are from your car crashes and from your work injuries. Our training and experience has placed us in a very good position to also act as expert witnesses for these injuries, something that we've done extensively throughout the years. Today's topic, whiplash injuries, what you don't know may hurt you, has been something that I've been thinking about for quite a while. It has been something that I feel that has been minimized throughout the years. And why do I say that? I came across a couple of studies, one which said that 45% of chronic neck pain in the US is due to whiplash injuries. And almost half of these injuries don't heal properly. And realizing the fact that we're as much physical as we're emotional and spiritual beings, when you factor in that pain and that chronic pain that goes into, life, you can see how that ends up affecting somebody throughout a lifetime. And I believe that I'm hoping that by today's talk, if we can, I can shed off some misconceptions that surround these injuries. It will allow you, if you're unfortunately in one of these situations, to be able to take care of yourself properly and hopefully not have to have that burden of chronic pain. And I want today's topic to be as interactive as possible. As I mentioned before, if there are any questions, please jump up and chime in, and I think that's how we learn. Item number one, your injury and complaints have nothing to do with how minimal the damage to your vehicle was. Again, your injury and complaints have nothing to do with how minimal the damage to your vehicle was. Can an injury that basically, or a crash that ends up having scratches on a bumper be enough to injure you? Years of experience and years of research give a resounding yes. On a weekly basis, we have patients that come in and say, "Doc, it was just a ding. I don't know why am I hurt so bad." So a very well-versed practitioner in whiplash should have no problems explaining how and why you're injured and explaining the human factors that are involved with these injuries with you. Any questions? Okay. All right. Going to item number 2. Please get yourself checked out immediately. What do I mean by this? We tell every patient that the lucky ones are the ones who have pain right off the bat because they end up doing something about it. I'm always reminded of a patient who was involved in a crash with her husband. Her husband wasn't hurt. So 2 weeks into her injury, she is sitting down and just basically starts cursing him out. That lucky blankety blank, I can't believe he's not hurt. Why am I the one that's hurt? I look at her and I said, actually, you're the lucky blankety blank because you're here, you're taking care of it. If you understood physiologically and mechanically what happens to your body when you're involved in these crashes, you would drop everything and run to your chiropractor to get it checked out. Any questions? Okay, going to item number 3. Delay in onset of your symptoms are extremely common, so common that they're the rule. What do I mean by this? It is not uncommon at all for you to be experiencing just headaches or chest pain from the seatbelt. You go to the emergency room and that's pretty much your diagnosis. A couple days later, your neck starts to bother you. Your back starts to bother you. Your shoulders, your wrists. This is not uncommon at all. We had actually a patient who was involved in a crash and had neck pain and back pain. A couple of weeks into it, we're asking, how are you feeling? Any other complaints? And he said, you know what? My right foot has been bugging me for a while. I don't know why. Maybe I stepped off of something. So going back through the mechanics of the injury, we did realize that, well, your right foot was actually on the brake. And what happened when you got rear-ended and your body got pushed forward, your foot collapsed. And that collapsing mechanism on the brake is what caused the straining to your ligaments that came about. And that's why it's starting to hurt. The other symptoms are starting to go down, and that's why this one has started to come up. And again, going back to what I had mentioned earlier, that we're as much physical as we're emotional and spiritual. And if these complaints are not caught in time, they have a very high potential to become chronic. And also realizing the fact that the body is pretty much one chain link. And a complaint or injury in one area can eventually go and affect other areas as well. So this way, your practitioner, if they're well aware of how these injuries can occur, they'll be able to assess them right and then treat them right. So hopefully, these complaints don't become chronic. Any questions?
How long, if I get in a crash or something, how long should I be on the sort of lookout, listen out, feel out for a symptom?
Well, it's not a time factor. If something that wasn't there before and is causing problems now, mention it. If something that was there before, but it was manageable, but now it has become really intractable, mention it. Because if it's, and a lot of times, and I don't want to put all the burden on the patient, because a lot of times, we're always told in our postgrad courses, have your antennas up, because the patient may just, in a very subtle way, mention something real quick, and if your antennas are not to catch them, you're going to miss them. So I don't want to put that, the entire burden on you. Just like if, let's say, I'm a promising athlete and I, injure my shoulder, I'm not going to go to any doctor who's going to manage the shoulder. I have to, because I'm going to look at the fact that, right, this shoulder is going to be my livelihood. So I want to find someone who lives, eats, breathes shoulders on a daily basis. So this way, if you're injured, make sure that the individual that is going to be treating you has experience in evaluating and treating whiplash injuries. Ask them, what have you done to train yourself on whiplash? How abreast of you are you on, new research that is coming out, new treatment methods, new, diagnosis methods that are coming out? Because the more aware you are of these situations, the better you'll be able to go ahead and put yourself in a position where these injuries are going to be, not missed, basically.
Thank you.
You're very welcome. Any questions? Other questions? Okay. Going to item number 4, which brings everything together. Every complaint that you have from these injuries must be assessed properly and must be treated properly. Because if it's not, it has a high potential to become chronic. Going back to, again, to that study earlier, which said 45% of chronic neck pain in the US is due to whiplash. So if two people are standing side by side and they have chronic neck pain, chances are that one of them has had a whiplash history. Please make sure that whoever is evaluating you has the proper credentials and the proper training in evaluating and managing these injuries, because when they're minimized, the chances of them becoming chronic is very, very high. And going back to, again, what I had mentioned earlier, which is we're as much physical as we're emotional and spiritual. And chronic pain can really do a good number on how an individual feels emotionally and spiritually. Aside from that, if let's say you have a carrier who's trying to process this claim for you, if this information is not documented properly as to how and why it has occurred, there's a high chance of it also being denied. Because if I'm a carrier and all of a sudden out of 3 weeks later, the patient starts to complain of carpal tunnel-like symptoms, where did this come from? You can't suddenly throw that into the mix without explaining how the mechanics of this injury have led to it, how physiologically what the patient was doing prior to to being involved in that crash may lead to it. So again, the practitioner is not just there to go ahead and treat you. They also, if you have a claim that's pending, they also have a responsibility to you to be able to properly document these injuries for you, so this doesn't cause additional burden down the line, for you to say that, all these, my complaints are being denied. Nobody believes me. You don't know how many times I've heard patients come and say, nobody believes my pain. Okay, because again, pain is a very subjective complaint, and I'm here actually on a Zoom call with women, and you've all with birth. Okay, how many times one individual has no issues with birth, but another individual must get shot after shot after shot to be able to go through that process. Okay, that doesn't mean that birth doesn't hurt. Okay, it depends on the individual. I mean, there's a lot of different factors that pain presents with, and science is trying to do whatever they can to assess this issue properly. But again, I guess just like faith, you can't prove pain. But if someone is really understands these injuries in depth, they'll be able to, basically explain them and document them properly. So hopefully it won't be something that you won't be ending up as a statistic. And from a claim perspective, you won't have any issues, getting them properly assessed. Any questions? Yes, Patricia.
So I really appreciate hearing this, because too many times you've taken your kid to the ER after a trauma, and they check them over, and unless they're writhing in pain, there's no MRI, there's no CAT scan. And I use alternative modalities all the time, and I never thought, oh, maybe a chiropractic checkout would be a great idea here, because clearly this kid fell off of whatever or bashed into whatever, but the AMA isn't seeing it as blood and guts and broken bones, so therefore there's nothing there. I mean, it's the same reason you take them to an acupuncturist or whatever else. So it's enlightening. So thank you for that. And also, I had the pleasure of being treated after both of my kids' births, and that is huge. And I recommend it to all of my pregnant young friends. It's plan to have a treatment post-birth. That is hugely traumatic on your spine and rest of your bones.
Well, yeah, thank you very much actually for bringing that up, Patricia, because again, you have to understand that the emergency room's job is to rule out emergency. If it's not an emergency situation, their job is done. So, I mean, we have patients that complain they didn't do anything. They did. You're here. You're not. Your life is not in danger. They did their job. Okay, but and aside from anatomical issues, there's nothing else that they have. So a lot of these issues are mechanical, and someone who's trained in mechanical injuries should be able to pick them up. Like after it could be trauma, or birth, which is also traumatic on the body itself as well. Sharon, your hands up.
Yeah, I had because I love this. I mean, the foundation, we're all about prevention and follow up and and dealing with people on the other end of that chronic pain. But when you're looking, because this has happened, and I echo Patricia's about the emergency room, and they always say follow up with your
Yes.
care provider. So what are questions that somebody could ask to decide on which provider would be good for them? I mean, I know you say research, but a lot of times you can't see that. Everybody on their websites, they say they're fantastic. They say they deal in everything. So what would your suggestion be to weed through to get somebody who will really do what you're saying, really investigate the cause of what could be?
Well, as far as that, I would say training. Let's say, for example, if I'm in court and someone wants to, so say that, all right, I want to go ahead and, I bring about, let's say, Dr. Azami as an expert witness. They're going to ask about my training. Ask about, I know you're right. On the website, everybody's perfect. I have X amount of experience and everything else. Perfect. Okay, well, proof is in the pudding. Show me the pudding. So as a patient, you have every right to ask your provider, what is your training? What have you done? Okay, well, I studied it in school. How many years have you been out of school? Because again, the school's job is to pretty much have you pass your board and get your license. Their job is done. So after that, it is the job of, it's my job to go ahead and keep myself abreast of all the new things that are coming out. I mean, I can tell you right now that, the treatments that I used to do 10 years ago are different than what I do now. The things that I used to stress on 10 years ago are totally different now. So, you try, I mean, science continues to evolve. So as a consumer, when you're told that, right, I mean, after the emergency room, everything's good, follow up with your primary care. And unfortunately, when it comes to these mechanical complaints, the primary physicians, I mean, I don't want to take anything away from them, but that training isn't there for them. The training from, from a medical exercise specialist, I don't know if you have heard of non-specific low back pain. Okay, that's what they call it. So if something that can't be proven on the x-ray, can't be proven on MRIs, is non-specific. I mean, I've never heard of that diagnosis anywhere else. I've never gone to a dentist and the dentist told me, oh, you have non-specific toothache. Like, what do you mean? I mean, you can't find out what's wrong with it? Okay, or I have non-specific headache. Like, where did that come from? So it's again, depends on the specialty. And the reason why I also bring up research is because it is starting to back up the things that a lot of practitioners knew from practice. Anecdotally, it worked, but empirically, they needed backup, and that backup is starting to come around. So I urge you guys, from consumers' point of view, if there's any complaints, follow up with your practitioner. What kind of training have you had in these, with these? And the individual should have no issues pulling up their CV. Here, this is what I've done. Some individuals actually put their CVs up. I'm actually thinking about putting my CV up on my website as well. That I say I treat them, and this is the backup that I have with their treatments.
That's a great idea. Thank you so much. I know we all get so much out of your talks, and thank you so much for participating.
Thank you, everybody.
I want to turn it over to Sharon now from Life Energy Foundation. Tell us about the foundation, Sharon.
Well, we exist to help people with chronic pain and connect them to resources that are evidence-based and tools that they will be able to manage and improve their quality of life. So yes, we love, and ironically, I get a lot from people is like, what do I think of chiropractic practices? And I think people get surprised because I'm like, I love them. I mean, I definitely like relate to all of this. Like, get it done quickly before it becomes chronic. Because once that non-specific back pain gets into
Hmm.
your soft tissue, and you become from my standpoint, it's now a repetitive movement pattern that you're compensating. That is so much more difficult to get out of than if you initially attacked it and didn't develop it in the first place.
Exactly.
So I love your talk. It's awesome.
Thank you.
And this is why we support the Wellness Wednesdays as a sponsor, because it's all about prevention, healthy people, healthy lives. And we're all just more functional and can really, once we get back out in the world, enjoy it more.
Yeah. The key point that you mentioned, that we're all functional, and you can't forget about that. Yes.
And ironically,
Mhm.
function is different to everybody. I had one guy who was 93. He hired me to help him put his socks on, and he was thrilled when he
Yeah.
could put his socks on.
Yeah. Yes. Yeah. The little things in life that we take for granted for.
It's all about the quality and prevention. That I'm all
Yes.
for that myself. So thank you
Hugely.
so much. I know we're over our time. Next Wednesday is going to be a talk from Adventist. The topic is check in on yourself and your health.
Just one more point. I'm sorry.
Yeah.
My next talk next month, I'm going to be talking about treatment of these injuries and what you can hopefully do not to place yourself in that chronic situation.
Excellent. Thank you so
Thanks,
much,
guys.
everyone.
Great morning. Great to see
Thank you
you
so
all.
much. Everybody have a great day.
Enjoy
You
your
do the
day.
same. Thank you so much.
And
Thank you.
tomorrow at 1 is Meditative Thursday. So come join us for that as well.
Thank you. Thank you,
Okay.
Margie.
Thank you so
Thanks,
much.
Margie.
Yep.
Bye.
Have a
Bye.
great day.
Have a great day.
Bye, everybody. Have a great day.
Bye.